Hello and welcome to WSN Academy, where we talk about all things staffing. In this video, I'm decoding the major differences between a medical assistant or MA and a registered nurse, RN. The major differences in how to choose the right path for you, especially if, let's say, you're in high school and you're trying to figure out, want a career, you want a job, and you're trying to figure out the path to take. And the reason I wanted to make this video is because I remember when you are in high school or you're starting out, or maybe you're not in high school, maybe you're wanting a second career, or you've made a decision that now it's time for you to do something in your life. We are being fed a lot of information. A lot of this information comes from organizations or facilities or colleges or training centers that their main purpose is to get you into their facility. So without further ado, let's jump into the MA versus RN and navigating your nursing career path. But let me first give a brief explanation. What is a medical assistant? The best way I could describe a medical assistant, they basically work in clinics. They're the ones that check in a patient, do medical records, maybe they administer a shot. They're the hands-on patient care. Now, if you enjoy this kind of work, MA might be for you, but oftentimes you're working in a clinic, not a hospital. Typically, hospitals will not hire medical assistants. Now, a registered nurse, for example, a nurse can basically work anywhere. In a hospital, they're the ones in charge. They're the ones making the critical decisions. They're the ones coordinating the patient care. They play a central role in all things. Oftentimes, they are the gatekeepers for everything that has to do with the patient. And they play a huge impact on the hospital. The RN might be a path for you if this is something that you are thinking about. Let's look at the educational background and training of MA versus RN. Medical assistants typically embark on a quicker educational journey compared to registered nurses. To become an MA, you can pursue a diploma or an associate's program, usually lasting between 1 to 2 years. These programs provide a blend of classroom instructions and hands-on clinical training, covering a variety of topics. But essentially, it's 1 to 2 years. A registered nurse, on the other hand, involves a more comprehensive educational commitment. RNs can choose from various paths, including earning a diploma, an associate's degree, or a bachelor's degree in nursing. Usually these paths take anywhere between 3 to 4 years, depending on what facility, or if you're getting an associate's versus a bachelor's in nursing. This is much more, it takes a little bit longer than an MA as compared to an RN. The key differences between an MA and an RN lies in the length and intensity of the program. Medical assistants undergo shorter, more focused training, enabling them to enter the workforce swiftly and contribute to the patient care. On the flip side, though, the educational and training for registered nurses are more extensive, encompassing a deeper understanding of medical concepts, advanced clinical skills, and a more holistic approach to patient care. This distinction showcases the unique responsibilities and leadership roles that RNs assume in the healthcare landscape. So whether you're looking for a quick entry into the field or a more in-depth educational journey, these choices cater to your preferences and career goals. Let's look at career advancement. Medical assistants' career advancements is kind of limited. After gaining experience and expanding your skills, MAs can have certain advancements, but most of the time they're limited in a clinical setting. You can become a supervisor, but again, it's limited to the clinical setting. Registered nurses' career advancement, on the other hand, is much broader, and the career advancements options due to their in-depth education and training include, for example, they can pursue a master's degree, they could become a nurse practitioner, an NP, they could become anesthesiologists or a CRNA, they could become a clinical nurse specialist, a CNS, or a nurse educator, just specializing. RNs can specialize in pediatrics, oncology, psychiatry, specializations that allow them to go into other areas within the hospital. They could become, there's leadership roles. They could become a nurse manager, a director of nursing, a chief nursing officer. These are critical roles in healthcare organizations, hospitals. They could do research and education. They could engage in pursuing becoming a professor in a nursing program. So the advancements in opportunities for a nurse is much broader than, say, an MA. Now, let's look at the most important part of this presentation: salary and benefits. I'm sure you've been waiting for that. You hear and see a lot of things online, but realistically, what is the differences? Let's look at medical assistants, salary and benefits. The salary for medical assistants can vary based on factors such as experience, location, and type of healthcare facility, on average in the United States. Average salary, for example, for medical assistants, the median annual salary can range between $25,000 to $40,000 a year, with entry-level positions starting around $25,000. The benefits will be based on whatever a clinic offers. Typically, these benefits can include health insurance, dental, vision. All these things are very common in most jobs, and they are expanded based on the facility, what they're willing to pay for. Now, let's look at registered nurses. Registered nurses generally earn a higher salary due to their advanced education and expanded scope of practice. Average salary for an RN can range between $90,000 to $150,000. This variation depends on location. The benefits can be higher than an MA only because a nurse will typically work in a hospital as opposed to a clinic where resources are much higher. Let's look at the training cost. The training cost for an MA can range between $1,000 to $10,000, depending on books, certification fees, and what have you. RN, on the other hand, the training costs can range between, let's say, $20,000 to $100,000. Again, depending on what facility you're going to. Are you going to a private institution? Are you going to a community college? Are you going to a university? It just depends. Those are the differences between the cost between an MA and an RN. What is the long-term career and financial consideration? An MA has a shorter time to employment. One advantage of choosing a career as a medical assistant is the shorter time it takes to complete training and enter the workforce. This allows MAs to start earning sooner, potentially offsetting the initial investment in education. Registered nurses, on the other hand, have a higher initial investment. RN education involves a more substantial initial investment, considering the longer and more extensive training program. However, this investment may pay off over time as RNs generally command higher salaries and have more diverse career opportunities. Now, let's talk about a crucial aspect: your financial future. Say you decide to become an MA. Great, nothing wrong with that. The world needs MAs. Clinics need MAs. Doctors who have clinics need MAs. You are making, let's say you start. You go to school, after 1 year, you become an MA. You're making, let's be generous. Let's say you're making $35,000 a year. Sounds like a lot of money, doesn't it? Maybe you get some raises, and let's say you stay there for 20 years. Now you're making $45,000 a year in 20 years from now. It may become challenging to build significant savings or investments, potentially leading to financial strain in emergencies or retirement in the future. Another problem could be your housing options. Another issue is your housing options may be restricted. What I mean is, living in high-cost areas could pose challenges for you. The cost of healthcare can still be a burden, especially for unexpected medical expenses or healthcare insurance. You're going to have limited financial resources. Again, for example, if you're living in, say, New York or Florida, it's going to be tough. That amount of money works really good if you are not the main breadwinner. But if you are the main breadwinner, making $35,000 a year as an MA, it's not enough to live in certain states. Another challenge is going to be saving for your retirement. This will impact the quality of your life. Now, it may seem fantastic that you're making $35,000 straight out of high school, but give me a minute. Now, let me show you what a registered nurse will make. Now, you're earning, let's say, straight out of school, you're earning $90,000 a year. But okay, it took you 4 years to do that, and maybe you have a debt of $60,000. So now you owe $60,000, and it took you 4 years, and now you're making $90,000. Stay with me for a second here. That $90,000 is based on you working 3 12-hour shifts. What that means is, if you are very hungry and you want to pay off that debt, you pick up extra shifts. Each shift has the potential of making that payment to that $60,000 or $80,000 debt. In no time, you will pay it off. Yes, you sacrificed for 4 years to become an RN. Yes, you needed to work. And you thought, well, it's going to be very difficult. It's very hard. Let me tell you, I went to X-ray school. I did not know what a humerus or a obturator foramen was. These were concepts, these were words that were not something that I knew. I thought, there's no way I could become an RN. It's too difficult. The test is too difficult. How am I going to handle a lot of blood? And these are things that you start thinking about, and you start convincing yourself that you cannot do it. But let me tell you, you can. You can, and you can. We need you to become an RN. We need you to start going to RN school, because it may seem like a sacrifice right now, but in the short, long run, that financial difference is all the difference in the world. Now you have a different lifestyle. Your safety net has expanded. Your housing options have expanded. Now you could buy a house. Your lifestyle has expanded. You have more leisure time. You are able to travel and pay off those travels. You're able to contribute and enhance the quality of your life. You're able to save for retirement. And maybe you'll end up in a hospital that has a pension plan, so you don't have to save as much. Now, 20 years have passed by, and you're making that much more money. Maybe you're making $200,000 a year. And I'm not exaggerating here. This is a viable option for nurses. So you may think, 1 year, I'll make $30,000 a year, or it's going to take me 4 years to make $90,000 a year. It's a big difference. And I hate to say this, and I am sure I'm going to get a lot of hate mail from this, but a lot of the schools, you have to understand, they're businesses. They're in the business to convince you to go to MA school. They're in the business of getting those students from high school. And if they convince you that you could always go back to school, those courses you take for MA are not transferable to become an RN. A lot of times these schools play to the psyche of students. And when you're in class, they'll call you a nurse. But you're not a nurse. You're a medical assistant. You're not a nurse, and you cannot use those courses and those credits when you want to become an RN. Because what happens is, once you're an MA, you're making $35,000 a year. The natural progression of things is you're going to start having expenses. You're going to buy a car. You're going to have maybe rent. You're going to have responsibilities. It's very difficult to become an RN. Not impossible, but very difficult because you have these expenses. It's better just to wait, become an RN, and I tell you, we need more RNs in this country. We need you to look at the RN school. I have no affiliation whatsoever for any school. This is just a passion of mine. What I do is I teach people how to start their staffing agencies, but I talk about all things staffing. So when making a decision between becoming a medical assistant or a registered nurse, it's crucial to consider not only the upfront costs, but also the long-term return on your investment. While MAs may see a quicker return due to shorter training programs, RNs often experience higher earning potential over their careers. Additionally, the diverse career opportunities for RNs, including advanced practice roles and leadership positions, can contribute to long-term financial success. Ultimately, the choice should align with your career goals, interests, and level of responsibility you aspire for. While MA programs are more cost-effective and provide a quicker entry into the workforce, RN programs offer a more comprehensive education, leading to a broader range of opportunities and potentially higher earning potential in the long run. It's a balance between upfront cost and long-term career prospects. Choose wisely, dream big, and let your journey begin. Thank you very much.